The blood came before the call did. That was the detail nobody talked about later. Not the journalists who tried to piece it together. Not the RCMP officers who spent 3 days reviewing the trauma bay footage. And certainly not the man from CSIS who sat across from Nadia Voss in a windowless room at Vancouver General and asked, very quietly, where she had learned to do what she did. The blood came first. And Nadia already knew what it meant before the paramedics had even stopped the gurney. It was a Thursday in February, which in Vancouver means gray. Not the dramatic gray of a storm, but the flat, exhausted gray of a city that has been wet for 4 months straight and has simply given up pretending otherwise. The kind of gray that makes the fluorescent lights inside the hospital feel aggressive. Nadia had been on since 6 in the morning. It was now almost 11 at night. She had eaten half a granola bar at some point, and she couldn't remember when. She was not the kind of nurse people noticed. That was something her colleagues had said about her. Not unkindly, just honestly, the way you might describe a piece of furniture that did its job without demanding attention. She was 31 years old, medium height, medium build. Brown hair pulled back in a way that suggested she had stopped thinking about it. She spoke when she had something to say and was quiet the rest of the time, which in a busy ER meant she was quiet most of the time. The other nurses liked her well enough. The doctors found her reliable. Nobody had ever used the word remarkable. She had been working Trauma Bay 2 for 8 months. Before that, she'd spent a year in the general ward upstairs, and before that, she had done something else entirely, something she listed on her HR file as independent field medical work, contracted, and which nobody at Vancouver General had ever asked her about in any detail. The call came in at 22:47. Male, mid-30s, GSW to the upper left abdomen, and secondary penetrating trauma to the lower chest. BP crashing, ETA 3 minutes. Nadia was already moving. There was a particular kind of stillness she went into when things accelerated. The other nurses sometimes commented on it afterward, how she seemed to slow down when everything else was speeding up, how her hands got quieter the worse the situation became. Dr. Priya Acharya, the attending on that night, had noticed it the first week Nadia started and had filed it away as one of those professional mysteries she didn't have time to investigate. The gurney came through the bay doors at 22:51. The man on it was large, 6 feet, maybe a little more, the kind of build that came from years of deliberate physical maintenance rather than anything casual. He was wearing civilian clothes, dark cargo pants, a black jacket that had been cut open by the paramedics. But there was something about the way he'd been positioned on the gurney, something about the muscles' memory of how his body held itself even unconscious, that told Nadia things before she had read a single chart note. His name, she would learn later, was Callum Doyle. He was 36 years old. He was not supposed to be in Vancouver. BP 74/48 and dropping, the paramedic said, rattling off the rest of it. 2 large bore IVs established en route, 1 liter of saline pushed, GCS of 8 on scene, now maybe a 6. He was found in an alley off Cordova. No ID. Someone called it in anonymously. No ID. Nadia noted that, filed it. Dr. Acharya was already at the head of the bed. Let's get him on the monitor. I want a fast exam now. Someone get me. He's losing the abdominal bleed faster than the chest, Nadia said. Acharya looked at her. The entry wound angle on the abdomen. It's not a through and through. It's sitting low and left, probably clipped the descending aorta or the left iliac. The chest is secondary, painful but survivable. The belly is where he's going. The room paused for approximately 1 second. Then Acharya said, "Get the ultrasound." The fast exam confirmed it 40 seconds later. Free fluid flooding the abdomen. The aorta was compromised. He needs the OR, Acharya said. Get me vascular surgery on the phone right now. Vascular's in surgery, someone called from the desk. They're mid-case, at least 40 minutes out. 40 minutes. Nadia looked at the monitor. The blood pressure had dropped to 68/40. She did the arithmetic without meaning to, the way you do when the arithmetic has been embedded in you so deeply it runs, without your permission. He had perhaps 12 minutes. 15 if he was lucky, and luck was something Nadia had long ago stopped counting on. Dr. Acharya, Nadia kept her voice flat. I can place a Riboa. Zone 3, to bridge him until vascular gets here. The silence that followed was a different kind than the one before. Riboa, resuscitative endovascular balloon occlusion of the aorta. A catheter threaded up through the femoral artery. A balloon inflated in the aorta to slow the hemorrhage, buying time that didn't otherwise exist. It was a procedure performed by trauma surgeons and vascular specialists. It was not a procedure performed by nurses. It was not a procedure that nurses were trained for, credentialed for, or under any ordinary circumstances permitted to attempt. Voss, Acharya said carefully. That's not. I know what it is, Nadia said. I know how to do it. I've placed 11. Not in this hospital. Another second. The monitor alarmed. 64/38. Dr. Acharya was a good doctor. More than that, she was a fast thinker, which is a different and rarer thing. She looked at Nadia's hands, which were perfectly still. She looked at the monitor. She looked at the man on the gurney, who was going to be dead in 10 minutes if nobody made a decision. Do it, Acharya said. Nadia was already reaching for the kit. What happened in the next 7 minutes was something that the 3 nurses, 2 residents, and 1 respiratory therapist who witnessed it would describe differently depending on who was asking. To the residents, it looked controlled but alarming. A nurse doing something a nurse should not be doing, and the alarm of it kept overriding their ability to process the skill. To the respiratory therapist, a 20-year veteran named Gerald who had seen more than most, it looked like watching someone speak a language he hadn't known they knew. Fluent, certain. No hesitation between steps. Nadia found the femoral pulse with 2 fingers. She prepped the site in under a minute. The introducer sheath went in clean. She threaded the catheter, a 7 French, the only size in the kit, up through the iliac and into the aorta with the focused patience of someone doing something they had done many times in conditions far worse than this. She inflated the balloon in zone 3. The bleeding slowed, not stopped, slowed, which was what it was supposed to do. Pressure's coming up, someone said, disbelieving. 78/50, 82/52. Dr. Acharya had not moved from the head of the bed. Vascular, she said quietly to the resident beside her. Tell them we have a Riboa in place and we need them the moment they're free. Callum Doyle did not die in Trauma Bay 2. His pressure stabilized at 88/58. Not good, but survivable. Vascular arrived 31 minutes later and took him to the OR. The balloon came out. The aortic injury was repaired, and at 3 in the morning, a surgeon named Dr. Osi came back down to the ER to tell Acharya that the patient was in the ICU and would, against a number of reasonable expectations, probably live. Nadia was at the nursing station doing her charting. She had a cup of tea she hadn't touched. She was writing in the careful, thorough way she always wrote her notes. Nothing omitted, nothing exaggerated, just what happened and when and what she observed. She was not thinking about what came next. She should have been. At 4:15 in the morning, 2 men came through the ER's ambulance entrance. They were not patients. They were not family members. They were wearing plain clothes. Dark jackets, unremarkable in the way that things are unremarkable on purpose. One of them spoke to the charge nurse at the desk. The other one looked around the unit with the particular kind of attention that most people mistake for casualness, but that Nadia, who had learned to read rooms in places where reading rooms was survival, recognized immediately. He was looking for someone. He was looking for her. She kept writing. The first man's name, she would learn, was Agent Brodie Stahl from CSIS, the Canadian Security Intelligence Service. The second man was introduced only as Warrant Officer Ferris, attached to a special Schaltrines unit whose specific designation was not offered and which Nadia did not ask about. They pulled Dr. Acharya into a consultation room first. That conversation lasted 11 minutes. When Acharya came out, her expression was the careful neutral of someone who has just been told something that requires them to be very controlled about their face. She walked to the nursing station and said, simply, Nadia, they want to speak with you. Nadia saved her chart note. She stood up. She followed them into the consultation room, which was small and had a table and 4 chairs and a whiteboard with someone's old patient flow diagrams still on it in blue marker. Agent Stahl closed the door. "Ms. Voss," he said, "we want to start by saying that Mr. Doyle is going to recover, and that what you did tonight almost certainly saved his life." "I know," Nadia said. Stahl looked at her for a moment. "We'd also like to understand how you knew how to do it. I've placed a Reboa before." 11 times. "You told Dr. Acharya." "Yes. In what capacity?" Nadia looked at him steadily. "In the capacity of someone who was trained to do it." Ferris, who had been quiet until now, leaned forward slightly. He was in his 40s, gray at the temples, with the kind of posture that never fully relaxes. "Ms. Voss, Callum Doyle is a Canadian Special Operations Forces operator. He was on a domestic assignment that we're not able to detail. The circumstances of his injury are under active investigation. The people who shot him knew where he was going to be, which means there's an information problem we're trying to understand. And then there's you." "There's me," Nadia agreed. "An ER nurse with no surgical credentials who just performed a procedure that most trauma surgeons would hesitate to attempt, and who apparently did it without hesitation, under pressure, correctly. You understand why we're here." Nadia was quiet for a moment. Outside the consultation room, the ER continued its low constant noise, a monitor beeping somewhere, a door, someone's shoes on linoleum. Normal sounds. She had spent a long time learning how to stay inside normal. "I was a combat medic," she said finally. "Not officially. I contracted with a private medical support organization that worked alongside Canadian and Allied special operations teams in Mali, then in northern Iraq, then briefly in the Philippines. I did that for 4 years. I left in 2019. I came back to Canada, did my nursing accreditation, and I've been working here since 2021. Stahl was writing something down. "This organization is not something I'm going to discuss in detail without a lawyer present," Nadia said pleasantly. "I'll tell you everything you need to know about my qualifications. I'll tell you what I did tonight and why I made the decisions I made. But the operational details of that work are not mine to give." Ferris looked at her for a long moment. Then something in his expression shifted. Not warmth exactly, but recognition. The way one person sometimes looks at another when they realize they are, in some fundamental way, speaking the same language. "Fair enough," he said. "The interview, it was an interview, not a detention. They were careful to say that, and they were equally careful to close the door, lasted 2 hours. Nadia answered what she answered, and didn't answer what she didn't answer. And by the end of it, Stahl had filled several pages of a small notebook, and Ferris had said very little, and the sky outside the one-high window had gone from black to the particular blue-gray of a Vancouver winter dawn. At one point, Stahl asked her if she had any idea who might have wanted to hurt Doyle. "No," she said. "But you knew he was military, before we told you." "Yes. How?" "The way he held his body," Nadia said. "Even unconscious. The callus pattern on his hands. The scar configuration on his left forearm, that's not a civilian injury. That's a training scar. And it's not new. Small things. The kind of things you notice when you've worked around people like that for a long time." Ferris wrote something down. For the first time, he wrote something down. What Nadia did not tell them, not that night, not in that room, was what she had found. It had happened during the procedure when her hands were inside the controlled chaos of the trauma bay and her mind was running 2 tracks simultaneously the way it had learned to. One track on the catheter, the placement, the pressure readings, the patient's color, the other track processing everything in the peripheral field without being asked to. It was not something she could turn off. It was something she had been trained into over 4 years in places where the cost of missing a detail was measured in lives. The man who had come in with the paramedics. Not a paramedic. She had clocked that immediately. Someone who had ridden in with the crew, but whose hands never touched the patient, whose eyes moved the wrong way, too systematic, too controlled for a bystander. He had stood at the edge of the bay for 40 seconds before the charge nurse asked him to move to the waiting area. In those 40 seconds, he had looked at Doyle's face. He had looked at the trauma team. He had looked very briefly at the monitor readings, and then he had taken out his phone. Not to make a call, to send something. She had seen the motion. thumb moving upward, a quick send gesture, before he pocketed it and stepped back. She had kept her eyes on the catheter. She had not reacted. She had filed it. After the CSIS agents left, after the sun had fully risen, and her shift had technically ended 3 hours ago, and she was still sitting at the nursing station because she did not have the particular kind of tired that makes you want to sleep. She pulled up the ER's visitor log on the intake tablet. The man had not signed in. Of course he hadn't. She thought about calling Stahl. She had his card. She also thought about what Ferris had said, an information problem. Doyle had been found because someone knew where he was going to be, which meant the leak was upstream, which meant it was possible, not certain, but possible, that calling CSIS to report what she had seen would be calling the wrong number. Nadia sat with that for a moment. Then she did what she had learned to do in Mali in 2016, in a situation not entirely unlike this one, when the right people and the wrong people were wearing the same uniforms and the only reliable compass was what you had seen with your own eyes. She wrote it down, every detail, the man's height, approximate age, the jacket he'd been wearing, the phone, black, older model, a case with something on the back she hadn't been able to fully resolve, possibly a sticker or a logo, the timestamp, the motion of his hands. She wrote it in the small notebook she kept in the left pocket of her scrubs, the same kind of notebook she had kept in her kit bag for 4 years in places that didn't have reliable digital infrastructure. Then she called a number she had not called since 2019. It rang 4 times. Then a voice she recognized, older now but recognizable, said, "I didn't expect to hear from you." "There's a situation," Nadia said. "I need a name run." A pause. What kind of situation? The kind that started with a shooting and ended with CSIS sitting in my break room asking me questions. Another pause, longer. "Are you safe?" "I'm at work," she said. "I'm fine. But I think someone in that ER last night was tracking a patient, and I think whoever that person is, they're going to know by now that the patient didn't die, which means they're going to want to know why. Send me what you have." She photographed the notebook page. She sent it. She went back to work. There were 4 other patients waiting. A teenager with a laceration on his forearm from a fall, a woman in her 70s with chest pain that turned out to be muscular, a man who had been waiting 3 hours with a probable kidney stone and was by now in a state of impressive suffering, and a child, about 8 years old, who had swallowed a small toy and was annoyed about the whole situation in a way that Nadia found quietly charming. She moved through all 4 of them. She was careful and thorough, and she did not let any of what was running underneath the surface show. That, too, was a skill. At 10:30 in the morning, Ferris called her. Not Stahl. Ferris, on her personal cell, which she had not given him. "You wrote down a description last night," he said, without preamble. "The unauthorized individual in the trauma bay. Nadia was in the staff hallway. How do you?" "Because we have cameras in that bay, Ms. Voss, and we reviewed them at 06 this morning." "You were watching him." "We missed it the first time we went through the footage. You were watching him, and then you were writing something down after, and I want to know what you saw." She looked at the ceiling for a moment, old tile water stain in the left corner. She had looked at that stain 100 times. "I'll tell you what I saw," she said. "If you tell me something first, depending on what you want to know. The information problem you mentioned. How far up does it go?" A long pause, long enough that she counted it. 8 seconds. "Far enough that we're being careful about who we talk to," Ferris said. "That's what I thought," Nadia said. "The man in the bay. He sent a message, not a call, a message, quick send, in the first 40 seconds he was in there. Before we knew if Doyle was going to survive, he was reporting in. But the report would have been inconclusive because Doyle wasn't dead yet and the situation was still open, which means whoever he reported to may send him back." Silence. "He had something on the back of his phone," she continued. "I couldn't fully make it out. Black case, older handset. Something on the back that might have been a logo. Triangular, maybe, or a partial shape. Red or orange. I couldn't be certain of the color in the bay lighting." She heard Ferris writing. "You have good eyes," he said. "I was trained to," she said, by people I won't tell you about without a lawyer. Are we clear on that? We're clear. Then find your man, Nadia said. And when you do, I'd appreciate being told. Professionally. Why professionally? Because if he comes back to that hospital, I'd like to know what I'm looking at. She hung up. She stood in the hallway for another moment. The water stain on the ceiling, the distant sound of the ER doing what ERs do, which is continue, always continue, regardless of what has happened in the hours before. She thought about Callum Doyle upstairs in the ICU, breathing through a ventilator with a repaired aorta, and no idea who had sat in the waiting area of his trauma bay and typed a message into a phone to tell someone he was still alive. She thought about Molly, 2016, about a situation that had started the same way, a wounded soldier, a compromised location, a man who didn't belong in the room, about how that one had ended. She put the notebook back in her pocket, back to the desk, and picked up the next chart. Her handwriting was very steady. It was always steady. That too was something she had learned. That the things running underneath didn't have to show on the surface. That you could hold an enormous amount of information, an enormous amount of awareness, and still present to the world as simply the nurse in Bay 2, the one nobody much notices, reliable, medium, unremarkable. The granola bar she'd been meaning to finish since yesterday was still in her other pocket. She ate half of it at the desk while she read through the chart for the next patient, a 44-year-old man named Derek with an infected leg wound and a complicated look on his face that said he'd been putting off coming in for too long. She called him in. She was careful with the wound. She explained what she was doing and why, and he listened in the way people listen when they're grateful but don't know how to say it. When she was done, he said, "You're very calm for someone who must see a lot of awful things." Nadia disposed of her gloves. She noted the wound measurements in his chart. "It helps to know what you're doing," she said. 6 days later, Ferris called again. A man had been identified and taken into custody in North Vancouver. He was being held under the Security of Information Act. The details were not something Ferris could share. What he could share was that the information problem was being contained and that Doyle's location, the assignment, the operational details, had apparently been moving through a channel that was no longer open. "We found the logo," Ferris said, "on the phone case. You were right, triangular. Private security contractor based out of Calgary. 3 of them had access to Doyle's file." Nadia was at home by then. She was sitting at her kitchen table with a cup of coffee that was actually hot, which was unusual. Outside her window, Vancouver was still gray, but a slightly different gray, the kind that sometimes breaks open into something better. "Thank you for telling me," she said. "Thank you for what you did," Ferris said. And then, after a pause that felt deliberate, "I'm going to ask you something, and you can absolutely decline. Go ahead." "We have a training capacity question. For operational medics working in complex environments, there's a gap in advanced hemorrhage control instruction, particularly endovascular techniques. You'd be listed as a contracted subject matter expert. 14 days a year, maximum. You'd keep your position at the hospital." Nadia looked at the coffee. She looked at the window. "Send me the paperwork," she said. "I'll have my lawyer look at it." She heard something in Ferris's voice that might have been the edge of a smile. "Of course," he said. She hung up. She drank the coffee while it was still warm, which almost never happened. The next morning she was back in Bay 2 by 6. A new shift, new charts, the particular smell of a hospital in the early morning that is its own specific kind of familiar. The stain on the ceiling in the hallway. Gerald from respiratory nodding at her as she passed. Doctor. Acharya coming in at 7, pausing at the nursing station, looking at Nadia with an expression that had something careful and curious in it, something that hadn't been there before. "Morning," Acharya said. "Morning," Nadia said, and that was all. Because some things don't need to be said, and because the first patient was already waiting, and because the work was always there, steady and real and present, the way it had always been, the way it would continue to be. And Nadia Voss, who nobody had ever called remarkable, went in to do it.